Hello, welcome to the 2014 version 5.1 HUD Data Standards webinar. I'm your trainer, HMIS Systems Specialist, Shantae Smith. Though you may hear us refer to these as the 2016 HUD Data Standards, for clarification, these changes are really only a version of the 2014 HUD Data Standards version 5.1. We will cover the questions that affect everyone first, then the program-specific changes. If the program changes do not apply to you, then you do not need to watch the entire video. The program-specific changes affect HOPWA, RHY, PATH, and SSVF project types. Let's talk about the first change. Gender. When reporting a client's gender, we once had the option to report female, male, transgender male to female, transgender female to male, other, and data not collected. They have since removed that option of other and added in the option of does not identify as male, female, or transgender. Also, you will notice another change with disabling condition. This is now required to be collected for all clients. This includes children. The question itself has not changed. Living situation. This is in reference to your client's residence prior to project entry. They have now included these residences to have headers to explain what they are. First, you have a homeless situation, which now includes the term of interim housing. Next, you have an institutional situation. Then there are the categories for the transitional and permanent housing situations. Lastly, you have the option of client doesn't know, client refused, and data not collected. Interim housing is not a type of housing, but rather a housing situation where a chronically homeless individual has applied for permanent housing, has been accepted, a unit or voucher for permanent housing has been reserved for them, but for which there's a situation that prevents them from moving immediately into housing. In such cases, where it has been determined to be absolutely necessary that to keep the client engaged in moving towards housing, a temporary solution must be utilized and transitional housing is used. The client should then be identified upon move-in to the permanent house as coming from interim housing. This will enable that individual or household to be identified as chronically homeless at intake for reporting purposes. Note, this housing is not a substitute for a waiting list or any situation other than identified here. Next, we will discuss certain living situations. In the event that your client is entering your project from an emergency shelter, this is what your screen will look like. It will ask you the residence prior to project entry. It will then ask you the length of stay in previous place. Next, you will be prompted to answer a question saying if yes, for client entering from the streets, emergency shelter, or safe haven, what is the approximate date homelessness started? This is asking you when did the most recent episode of homelessness begin? Next, you are going to be asked, regardless of where they say last night, the number of times the client has been in the streets, an emergency shelter, or a safe haven in the past 3 years, including today. And then the total number of months homeless on the street, an emergency shelter, or safe haven. If your client is entering your project from a rapid rehousing to an emergency shelter, the residents If your client is entering in a rapid rehousing project coming from an emergency shelter, the residents prior to project entry would then list emergency shelter, your length of stay in previous place. It will then ask you if yes for client entering from emergency shelter, streets, or safe haven, What's the approximate date the homelessness began? Regardless of where they stayed last night, the number of times the client has been in the streets, emergency shelter, or safe haven the past 3 years, including today, and the total number of months homeless on the street, an emergency shelter, or safe haven in the past 3 years. If your client is entering into transitional housing from an institution with more than a 90-day stay, these are the list of questions you will see. You have your residence prior to project entry. Then it will ask you the length of stay in previous place. And then you will be asked, did you stay less than 90 days? Please note that this answer will automatically answer itself based off of the answer provided for length of stay in previous place. If your client is entering into a permanent supportive housing from a transitional housing program, you will be asked the residence prior to project entry, the length of stay in previous place. And please note, if you answer this 2 to 6 nights, you will get asked the question, did you stay less than 7 nights? This answer will automatically populate to yes based off of the answer you provided for length of stay in previous place. You will then be asked, is the client entering from the streets, emergency shelter, or safe haven? This is answered yes, because prior to the transitional living facility, your client was living in emergency shelter, and the stay in the transitional living facility was less than 7 nights. If yes, for client entering from the streets, emergency shelter, or safe haven, the approximate date homelessness started. Regardless of where they stayed last night, the number of times the client has been in the streets, an emergency shelter, or safe haven in the past 3 years, including today. The total number of months homeless on the street, an emergency shelter, or safe haven in the past 3 years. Now, let's head into the system to take a look at our client data standards. When completing the Universal Entry Assessment, the universal data element will flow as such. The relationship to head of household will be the first question you see on your assessment, and since I serve singles in my pretend project, I'm going to mark my client as self head of household. Next, my client reports their date of birth, and the date of birth type is fully reported. Next, our client reports to be biracial, therefore we list the primary race, the secondary race, and their ethnicity. One of the first changes you will notice here is the gender. We have female, male, transgender, male to female, transgender, female to male, does not identify as male, female, or transgender, client doesn't know, client refused, and data not collected. As described in the previous slides, the option of other has been removed and replaced with does not identify as male, female, or transgender. For this example, our client reports to be male. Next, you have this question, does the client have a disabling condition? Remember, this is required for all clients, including children. Next, we will decide our client's homelessness primary reason. Next, we will talk about living situations. The first question you will see is the residence prior to project entry. This is saying, where did your client sleep the night before they checked into your project? What the slides previously explained is now, each residence prior to project entry will have its own homeless situation. You will now see these headers listed for a category. The first type of situation is a homeless situation, which means place not meant for habitation, emergency shelter, including hotel or motel paid for with emergency shelter voucher, safe haven, and interim housing. Institutional situations are foster care home or foster care group home, hospital or other residential non-psychiatric medical facility, jail, prison, or juvenile detention facility, long-term care facility or nursing home, psychiatric hospital or other psychiatric facility, substance abuse treatment facility or detox center. Next, you have the transitional and permanent housing situations, beginning with hotel or motel paid for without emergency shelter voucher, owned by client with no ongoing housing subsidy, owned by client with ongoing housing subsidy, permanent housing for formerly homeless persons, rental by client, no ongoing housing subsidy, rental by client with VASH subsidy, rental by client with GPD tip subsidy, rental by client with other ongoing housing subsidy, residential project or halfway house with no homeless criteria, staying or living in a family member's room, apartment, or house, staying or living in a friend's room, apartment, or house, transitional housing for homeless persons, including homeless youth. Then your options of client doesn't know, client refused, and data not collected. For the first example, let's select place not meant for habitation as a homeless situation. Once you select that option, you will then see the questions that follow become conditional based off of your residence prior to project entry. So then you will answer the length of stay in previous place. The options are 1 night or less, 2 to 6 nights, 1 week or more but less than 1 month, 1 month or more but less than 90 days, 90 days or more but less than 1 year, 1 year or longer, client doesn't know, client refused, and data not collected. Let's say that our client reports to be on the streets for 1 year or longer. Next, it will ask you the approximate date homelessness started. So they are asking, when did this length of stay in previous place begin? Next, they will ask, regardless of where they stayed last night, the number of times the client has been on the streets, in emergency shelter, or safe haven in the past 3 years, including today. Then you will be asked the total number of months homeless on the street, emergency shelter, or safe haven in the past 3 years. And then you will be asked to record your client's zip code of last permanent address. In the event that your client cannot remember the specific 5-digit zip code of where they were last housed for 90 days or more, please take your cursor and hover over the question, and we have provided you with a generic cheat sheet with zip codes that you may list. And then you must answer the question of client location. There is only one option, so please answer it. Next, let's look over the questions if a residence prior to project entry was from an institutional situation, such as jail, prison, or juvenile detention facility. Based off of that answer, you will be asked the length of stay in previous place. And please note where the next question will say, did you stay less than 90 days? This will automatically be answered to yes, based off of the length of stay in previous place. Then it's asking, on the night before, did you stay on the streets, emergency shelter, or safe haven? It's asking, on the night before you entered jail or prison, were you on the streets, emergency shelter, or safe haven? If the answer is yes, then you will be prompted to answer the approximate date homelessness started, regardless of where they stayed last night, the number of times the client has been on the streets, emergency shelter, or safe haven in the past 3 years, including today, and then the total number of months homeless on the street, in emergency shelter, or safe haven in the past 3 years. If this length of stay of previous place was more than 90 days, you will see that the questions will change to say, did you stay less than 90 days? No, and that is all you will need to answer. Let's say that the other example is from a transitional or permanent housing situation, such as a transitional housing for homeless persons. So then you will be prompted to ask the length of stay in previous place, and let's say it's for 1 year or longer. If so, it will ask you, did you stay less than 7 nights? And it will automatically say no. In the event that your client was using transitional housing for 2 to 6 nights, the prompt will then change to did you stay less than 7 nights to yes. So then on the night before you entered the transitional housing for homeless persons, were you on the streets, emergency shelter, or safe haven? If this answer is yes, you'll be prompted to answer these next 3 questions. If the answer to this is no, the questions will go away and you can proceed with the assessment. The next change that you will need to take note of is involving health insurance. There is now a new PIC list value for Indian Health Services Program. In the event that your client receives an other type of health insurance that is not available on this list, please select the option of Other and you will be provided with a text field box below to specify what Other means. Now onto the project-specific questions. For PATH projects only, the income and sources, non-cash benefits, health insurance, and connections with SOAR are now required at entry for all clients served. You will also see a change to your services and referrals PIC list. For HOPWA specific projects, there has been an addition after the T cell, which is the CD4. It will be collected throughout project duration. You will also notice edits have been made for the PIC list of your viral load. The yes/no values have been replaced with undetectable, not available, and available. For SSVF projects, the collection of last grade completed has been added. There are 21 new fields and varying new PIC lists for the homeless prevention project types to be answered on the head of households only. New elements were added for the head of household and adults only to be recorded at entry. The number of visits to an emergency room in the last year, approximate number of nights in jail or prison in the last year, an approximate number of nights in an inpatient medical facility in the last year. For RHY project types, minor changes have only been made to the services and referrals PIC list. Now that we have got over the critical changes, please refer to the handouts that were provided last week, as well as handouts provided attached to this email. In order to receive credit for watching this webinar on the new data standards, you must take the quiz through SurveyMonkey. The link is listed here and it is also attached in your email. As a resource, please refer to this PowerPoint, your reference sheets, and the HUD Data Standards Manual. For any questions, please contact us at the HMIS Help Desk at 602-908-3605 or email us at hmissupport@cir.org. Thank you so much for joining us, and we will all speak with you soon.